The health docket is a big docket. It's a very serious docket. And also is a docket with a lot of contestation and a lot of conflict. Having said that, almost 4 years ago, we sent many doctors to Cuba. And also Cuban doctors came to Kenya. We never had any feedback. I really want to hear from you what has been that feedback, whether positive or negative, and if there are any positive things, what is it that we have been able to borrow from the Cuban health system? A second question is, you have been a medical registrar at Kenyatta National Hospital. Across the road, you walk to Nairobi Hospital. In Kenyatta National Hospital, you have the largest Kenya Medical Training College in Eastern Central Africa. And also, you have the largest teaching hospital, university that trains doctors. When you compare the two facilities just across the road, in one you are in Europe, and in the other one you are in somewhere in Africa, not even in Nairobi. Just in case this committee is going to approve your nomination, what is it that you are likely to do so that we are able to see a better facility at Kenyatta? Finally, Honorable Speaker, there are memorandums that have been raised by Albert Gitonga, Henry Fundi, and two others about your practice status at the Kenya Medical Practitioners and Dentists Council. What have you got to say about that? Thank you, Honorable Chairman.
So, in terms of the feedback for the Cuban doctors, I have not been to the ministry. I'll be new to the ministry, and this will be a priority agenda. So I will review, and I'll be able to make a report and share with the Parliament. Regarding the training in the Kenyatta National Hospital and how to make our facilities better, routine facility assessments, identifying gaps, and coming up with international interventions to build up capacity is really critical. And I will be an advocate for that and ensure that we are conducting routine assessment. For my practicing license, I am a qualified doctor. My registration is A6275. I have been in clinical practice from 2007 to 2020, compliant to license renewal. In 2020, I joined World Health Organization. It is a UN, part of the UN agencies. It is an international, independent entity with no affiliation to any member states. I was an international civil servant, offering services to 22 countries in Eastern Southern Africa, and the 47 member states also supported in the Afro region. So my work and my capacity was at an international level as a policy advisor, giving strategic direction and technical advice to various countries in the Afro region. Once the President nominated me as Cabinet Secretary, because of the courtesy and respect and coming back into the Kenyan medical environment, as well as the office of the Cabinet Secretary, I renewed my clinical practice.
Mule.
Thank you very much, Chair, and welcome Dr. Baraza to this committee. Chair, I've pursued and I've looked at the CV of the Dr. Baraza. Having worked at Kenyatta Hospital as a registrar, Mata Hospital as a promotion, worked at Eastern Deanery as a physician and promoter, and then straight to WHO. I have no doubt on your experience, but I have a serious concern of where you are coming from and where you are getting into. And I think Kosin alluded to that. We want to hear you, how you will transit. Having been in the medical fraternity for the last 20 years, where you are coming from is where things are done as the policy of the institution. You are joining government whereby complex law, interest, politics carries the day. Madam, with all due respect, I believe you are getting into the Ministry of Health, whereby we have several departments, starting with the doctors themselves, starting with the nurses, the procurement agency, KEMSA, the programs, everything. I want to hear from you your management skill, on how you transit from that set mind of a straight line of thinking, and no wonder you are telling us every time consultation. Here, it is whereby the law applies. The law which is applied at KEMSA is not the same law which is applying with the doctors, enumeration and hiring. So, my question starts with, how do you tell Kenyans you'll streamline supply and demand of health communities in this country to the grassroots level, putting in mind we still have a devolved government? Secondly, from the international community where you are coming from, there are those policies and guidelines which are being given to this country we must adhere to. One, Honorable Mukami talked about Gavi and vaccines. You know very well Gavi has been supporting this country for many years to provide vaccines and other commodities. But as a government, we have always delayed to pay these supplies, yet endangering the young newborns and the future of this nation by not being vaccinated and exposing them to diseases like polio. What is your take to how to progress on that? Thirdly, as a country, we are binded by all international commitments, starting with the United Nations Convention on on health policies. And I want to hear from you, how do we get out from donor-funded health programs in this country to a government-funded programs in this country on TB drugs, TB diagnostic tools, HIV drugs, HIV diagnostic tools, vaccinations and distribution of vaccinations to the country, malaria drugs and malaria transmission diagnostic tool. And last, how do you coerce the seamless working relationship between the Ministry of Health and the county government, putting in mind the largest budget within the ministry remains at the national government, and what is required to be transferred to the county government, it is transferred. And lastly, what policy are you going to use on relationship on working with the county government and the CECs at the county level to ensure that Kenyans does not suffer anymore for lack of health services in this country? Thank you.
Quite a mouthful. Can you answer that?
Thank you, Honorable Member.
Honorable Mule.
Honorable Mule, my sincere apologies for that. And indeed, I sense a lot of passion in matters health. And if hopefully given the opportunity, I believe we'll work together to address some of these pertinent issues. Yes, so Again, this will be a priority in my agenda to understand the situation and come back with interventions, seeing that I will be new to the ministry. So the issue of supply and demand, again, we need to strengthen the information system. I think my mind has been focusing on that because I have seen it work. I have seen it work in various organizations that I have worked in. I have seen it being rolled out. I've seen the teething effects, but I have seen the impact it has had. It has reduced on costs, it has improved quality, and it has enabled people to track and see where their stockouts, among others. So we can be able to track the supply of commodities up to the last mile. Yeah? And then we can be able to also monitor other services. So I am an advocate of the digital platform because the human-to-human interface is what is bringing challenges, I believe, in our country at the moment, among other things. So for the vaccines and commodity delivery, yes, we need to allocate budgets to support this, and then we can have pooled procurement of vaccines. We'll also deliberate with the vaccine programs that are currently here, the vaccine production, and see on their effectiveness and their efficiency, and the cost implication. So, coming from my background, I know the concerns, the teething effects of vaccine production, and I know the members, the nominated committee wanted me to talk about vaccine production, but I think it is important that we go in depth and identify all these things before making commitment. In terms of health policy, for the dwindling donor funds, one of the areas we can consider is health insurance, but again, we need to have community ownership. The community need to embrace it because, you know, there are taxes involved. So we'll need to educate them and make them embrace it with your support, with the county government support, the stakeholders, the partners. I believe we can make this successful. And equally, there are some programs which are again feeding into the universal health coverage, including maternal to child health programs, the TB programs, and so on. So we can see how to work as a team and synergize our efforts for improvement of services in Kenya.
As we sit here, there are Kenyans who are watching, and they have been sending some SMSs to almost all of us. A few of them, they say, in case you're approved, embrace biotechnology and diagnosis, harmonize salaries of health workers. They earn different salaries while doing the same job. Somebody else says there's a program called Edu Afia for students. It was suspended because of fraud instead of punishing the fraud. Another one says advise her to solve UHC staff menace. They get only half salary for full work. Another one says Linda Mama must come back. That's what Mishi was saying. Another one says ensure SHIF covers ICU costs which are unaffordable by all Kenyans. Another one says how will you handle monkeypox disease if you are confirmed?
Chair.
And you had answered that.
Chair.
Yes. Yes, Mule.
Chair, I did hear touch on the issue of diagnostic tools as recommended by the UN on the TB, HIV, and also supply of vaccines and drugs for malaria and the diagnostic tools for malaria. Please.
Yes, go ahead.
Yes.
The ones I've given here are just comments extracted from SMSs. Can you answer the members?
Thank you, Honorable Muli, for the question, and through you, Honorable Chair. Yes, this is an agenda that will also be priority in my list, to be able to identify the situation and the gaps and the interventions therein. Regarding monkeypox, I'm happy to say that within this year, we've had multiple countries within the Afro region that have had monkeypox. And I have been part of the team that has been supporting the countries. And so I believe that this, with the support from the National Technical Working Group, we will be up to task to support the country to address monkeypox in terms of readiness and response in Kenya.
Daud, what was it?
Thank you, Mr. Speaker. I want to follow up what my colleague, Honorable Imase Mary, asked about facilities which have not been opened. A case in point would be even Meru, where there is a 5-story building which was done by Honorable Kiraito. He was the governor. 3 years down the road, it's never been opened, and there is congestion in Meru level 5. So there are many places like those. Do you think once you get in, you will say it is not national government, it is county government? What would your position be on those unopened facilities?
Take also from the Deputy Speaker.
Dr. Deborah, also some concerns that have been raised by members of the public who've sent me messages. They are saying that the community health promoters are being paid timely from the national government, but the contribution of the county governments comes in very late. I think they've been said that Isiolo County, they are currently on strike because they have not been paid. Nyamira County have not been paid for 9 months. So how will you ensure that the county governments are also able to make their payments as government does, national government does its contributions?
Yes, Owen.
Thank you very much, Speaker. Dr. Deborah, just 2 quick questions. One, there has been worry of staff of NHIF transitioning to SHA or SHIF. They are worried about losing jobs. We have a law that is in place, but they're worried. What is your take on this? Are you going to transit all of them? Are you going to ensure all of them have jobs, or others will lose jobs? This is a concern of NHIF staff. How do you respond to them? And secondly, what legislative proposals do you have to strengthen the health sector as you take over, if approved by this committee? Do you have any legislative proposal you want to make here? Because these are legislators and they will support your agenda. Do you have any legislative proposals going forward so that we can strengthen the health sector? Or what gaps are there in the law that you may want to fix to make health a better sector?
Go ahead and answer those.
Thank you very much, Honorable Owen, and for the questions that have been raised. So I will start with Honorable Dawood's question regarding facilities and their capacity. It is critical for us to monitor the capacity of healthcare facilities to ensure that they are up and running and they are offering quality services. And so it is critical that we conduct routine assessment to identify gaps and come up with intervention. I hope to work together with the county government in terms of identifying the gaps and supporting, because healthcare, the health system is not just the infrastructure itself. It is the commodities, it is the services, it's the human resource. So we need to look at all those things and ensure that our healthcare facilities are up and running. And that is a task that I would wish to take up, and in consultation with the counties. Again, the community health promoters, indeed, they are a critical component and a pillar for health service delivery. They are the ones who go to the community, supporting preventive, promotive, and rehabilitative activities. And so discussions with the county government on the gaps as to why they are not, the community health promoters are not receiving their money is really important, and it will again be part of my agenda. Regarding the NHIF, I'm still new to the ministry. I will need to review the HR capacity, the number of human resource that is required for the new insurance, but an intervention can be too much and move the HR, depending on their roles and responsibility, to the new area. So again, this is an agenda that we can have with the technocrats to see where the gaps are and how we can move the NHIF, because it is very sad when, you know, the sole provider of a family loses their job. And so this is something that we need to support our NHIF staff.
I was saying that the law that was actually passed in Parliament on the social health insurance and social health authority says that they will all be assessed, and if you have the skill set for the new system, you will be taken. So there is no guarantee. Don't set yourself up when you get there.